All right, do you get sick always at this time of year? Well, today's Ask the Doctor segment is all about how to stay well in the winter months. And we are joined by Dr. Gregory Mayberry from the Norwood Clinic. Thanks for being with us. If you have a question just about how you can keep yourself and your family healthier during the winter months, give us a call right now, 741-9272. That's 205-741-9272. And Doc, we already have some callers, so let's go straight to them. We have Joyce in Bessemer. Joyce, what is your question?
I have the flu already. Is it too early to have the flu?
No, ma'am. I mean, the flu season actually starts usually from October till mid-May, and then the highest incidence is from December to February. So it's not too early. That's the reason when they recommend you to get the flu shot as soon as it becomes available, preferably before October if available. So it's unfortunately not uncommon to have it this early. In fact, you can have the flu year-round. It's just more prevalent during these months because you're inside and in close contact with other people that may be sick also.
We were talking earlier that it's not so much that it's cold weather, it's just cold weather sends everybody inside.
Yes, ma'am.
And that's when you start passing all this stuff around.
Exactly.
So that's
exactly right.
why we need to be so careful during the winter months. We have another caller, Imogene in Tuscaloosa. Imogene?
Yes, good morning.
Good morning.
How are you doing?
Fine. Your question.
My problem is I can't take the flu shot. So, doctor, I would appreciate a recommendation. I've already got a little allergy from yesterday. You know, the cold winds blowing, and my eyes were dripping during the night. And any suggestions?
As far as just the overall, if you're not able to take the flu shot for some sort of allergies or things like that, any type of, if they're allergy-related symptoms, I mean, there's a variety of over-the-counter medicines, antihistamines that may help with all this blurry, dry eyes and runny nose type of things. But overall, it's just mainly you've got to have extremely good hygiene. I mean, wash your hands frequently and just make sure you're scrubbing adequately. A lot of us don't wash our hands appropriately. So unfortunately, if you're not able to take the flu shot, it's just mainly up to hygiene and just overall good health, where this diet and exercise.
So it's so simple, but it's just wash your hands.
It is.
What about the use of regular soap or antibiotic soap?
It really doesn't matter. It's all about how you use the time you wash your hands. I mean, a lot of times there's different people that tell you how to do it differently, but you want to lather, you want to scrub, and they say going through the little song that we all know, Happy Birthday, twice, gives you enough sufficient time of scrubbing. Okay. And then just washing it off with running water.
But that's one of the biggest things to keep
it really
it from
is,
spreading.
hygiene.
All right, we have Tim in Parrish. Tim, what's your question? Tim, I'm sorry, we're not able to, if we can get a little help with the audio there. Were you able to understand that? I'm sorry. Tim, apparently we have a bad connection. If you can maybe try to turn around and call us back or something. Other than hand washing, you know, we also know about cover your mouth when you sneeze or sneeze into your elbow. Does that really make a difference?
It makes a big difference because anytime you sneeze, you're dispersing these germs. So if you have a Kleenex or anything like that, you can cough into your hands, but otherwise I would encourage you to cough into your upper sleeve.
Anything specifically with children that we can do? Because I know people with kids in school and they say, oh, one comes home and then the whole family gets sick.
Yeah, I mean, it's basically just try to keep up the good hygiene. It's hard with the kid. I know because I have one 16 months and she gives everything to us. They're very giving in that regard. So mainly just hygiene. And unfortunately, 6 months and younger, they're not able to get the flu shot to begin with. So it's just mainly hygiene. Pretty much it.
Just take care of that. We have Dwayne in Irondale now. Dwayne, what is your question?
Yes, I was calling to ask what can you do about coughing and running nose?
So coughing and runny nose is very common this time of year. I mean, you got a lot of these allergies. I don't know if you've had a history of allergies, but a lot of pollens and different types of things are going around with all the leaf changes. But like the earlier caller, basically there's a bunch of over-the-counter medicines, but you should still talk to your doctor. I mean, just make sure there's no interactions with the medicines you're already on. But antihistamines, and if it is like a cough, there's over-the-counter medications like just cough syrups. But again, there's something you got to discuss with your doctor because there's interactions with other medicines. So just make sure you follow up with your regular doctor.
Your doctor and the pharmacist can help you out as well.
Exactly.
All right, Dr. Mayberry, thanks for being with us. We sure appreciate it.
Thank you.
And hopefully we'll all be much healthier as we go through the winter months. We'll be right back.